Welcome back to Revolt Black News. I'm Rochelle Ritchie, and we're about to have a very important conversation on mental health and the overall toll our people are enduring in terms of Black pain, Black trauma. From the COVID-19 pandemic to police brutality, the layers of trauma are exponential. And we need to unpack exactly how to protect our minds during these times. So joining me in this very important conversation is Married to Medicine's Dr. Contessa Metcalf. Can you define Black trauma for us so our audience can have an understanding of what exactly we're talking about?
For any Black person who is raised in America or even who's migrated to America, you always feel like a visitor in your own home. So things happen where our lives don't matter, right? We're less of a person. If you go all the way back to slavery. And then today, to kind of watch the news and to know that at any moment, not just in one city and then in another city way across the country, in the same city, the same infraction can happen again. Mm-hmm. We live in this constant state of uncertainty. And at any moment, anything can happen. And no matter what you do, education, you still are privy to being killed or canceled for any reason whatsoever. That's essentially the psyche that we live in.
Sometimes it appears that that mainstream media is constantly replaying this over and over again. Tell us how that can also impact Black people and how we can sort of protect ourselves mentally from seeing these images repeated on the mainstream news.
I think it's a paradoxical effect. For some people, they become desensitized. And that desensitization is really a problem because you don't humanize the fact that there is a life that we're seeing that's got snuffed out right in front of us. But for Black people, it just really reinforces, again, that it doesn't matter what you accomplish in your life. Because of your skin color, you just don't matter.
Now, as we go into this conversation, we talk about trauma, when we talk about pain, one of the things we have to obviously address is therapy. Those people that are unable to afford therapy, what are some of the ways that they can do, have some sort of mental health exercises that doesn't hurt their pocket?
One of the wonderful things about Obamacare is that it actually became something that was included. I know I was in the military, and so I was eligible for TRICARE, and so there was no copay. But then because I am a veteran, I can also go to the VA. And so that is something to mention because a lot of people who have served the country, even if it was briefly, you are eligible for care at the VA. The National Helpline, 1-800-662-HELP, the Disaster Distress Helpline, there is findtreatment.gov. And those are some of the resources that are available, SAMHSA, SAMSHA.gov, going to your county health department. If you can't or you don't feel comfortable engaging the healthcare system, some of the things that you can do is just go outside, right? Take a walk. Make sure you're connecting with people. Isolation is a killer. There is a stigma in the Black community about keeping stuff in your home. And I always believe that that is the source of toxicity. Transparency is freedom. And if you are in a network of sister girls, because I know I have a lot of good girlfriends that I can reach out to. If you have cousins, friends, neighbors that you really, I believe in also that family that you've inherited. You don't always have to have a blood relationship with someone for them to be connected to you. Use those connections and open your mouth and say what you are feeling. Because if you don't do it, it won't help.
I'm always down for a good walk. I feel like there is healing when you walk outside and you're in a green space. That is my therapy if I can't go and actually see my therapist, and also yoga.
And if you just 5 minutes of mindfulness, literally just focusing on your breathing. Focusing on nature, looking at a tree and just literally keeping your eye focused on that tree, breathing in and out, you'll be surprised what that does for your mood.
What exactly is generational trauma, and how can we address the traumas of our ancestors that we don't even realize that we're actually dealing with today?
We were brought to this country, without we didn't want to come here. And so then after being here as slaves, we then became indentured servants. And then Jim Crow then went to mass incarceration. Very small infractions can lead to Black people being incarcerated for not just, days and years, but decades. But then if you are not only getting that in society, but in your home, if you're not breaking generational curses in your home, this imposter syndrome, dealing with those things, this kind of lack or belief of inferiority. And so that all kind of just creates this whole psyche of of trauma that we learn to live with. And it's not that we're tougher. It's not that we can handle pain more frequently. It's that we have to endure pain. You got to just figure out a way to get the therapy that you need to improve.
We're also experiencing the trauma of the COVID-19 pandemic, which, as you know, has killed and infected African Americans, Black Americans, more than any other demographic in the country. And so it seems like we're getting this double dose when you're dealing with grief and you're dealing with death personally, and you're seeing so many people impacted by it. What is the solution to that?
Let's talk about people of color who may not have access to all of the health insurance, the physicians, the vaccine, whatever it is, that those things that kind of level the playing field for everybody, we're not having access. And then also throw in their isolation. If we don't find out some way to level the playing field, then we are going to 10 years from now still be suffering the effects of the pandemic of 2020. I'm super afraid of the long-lasting effects of COVID. So it's not just only about people dying. It's about getting the infection and not being able to fully recover and get back to that 100% level of being able to take care of your family and work full-time. And that's, for me, that's my biggest fear. I don't know how much I can stress, really looking online for different resources that are available. The Disaster Distress Helpline, 1-800-985 5990 is another one. Go to the cdc.gov, and that actually is a really fantastic link because you can type in get help and it will, throw up a vast amount of resources despite, whether your issues are mental health related or if it's something else. And you can put your zip code in and there's a locator for resources near you. Online help, telemedicine has really exploded, and accessing telemedicine, if that's something that's available to you right now, because you live in a rural area, do that as well.
Thank you so much for taking the time to share this very, very important information. So I appreciate you taking the time to join us here on Revolt Black News. Thank you so much for being here.
Thanks for having me.
And to everyone at home, be sure to catch more of Dr. Metcalf on Married to Medicine, airs on Bravo, Sunday nights, 9 p.m. Eastern, 6 p.m. Pacific. Ebony, it's back over to you.
All right, Rochelle, Dr. Contessa, thank you both so much for vocalizing the impact and the importance of Black pain as we all collectively try to absorb and process the trauma of our people. All right, y'all, now that brings us to resources. So important. With everything happening, y'all, our mental health right now, it's fragile and it's vulnerable. So do me a favor, check out the National Alliance on Mental Illnesses website. If you click on the Your Journey tab, you'll find a page devoted entirely to our community. There's a bunch of reading there, and they'll even direct you to a place where they call culturally competent care. So important, y'all. It's really clutch. Check it out. Also, the Anxiety and Depression Association of America's website. They've got a lot of resources there too. Check it out. And if you go under their Find Help page, of course, you can select the Black community under their drop-down demographics. Listen, what we're going through right now as a people is not easy, to say the least. But what we do hope is that after today's discussions, conversations, and resources that we're trying to make available, that the pain and the problems that affect our people become just a little bit easier. For Revolt Black News, I'm Ebony K. Williams. See you next time.